Shepherd Center is just an amazing place. I was drawn here as a resident. When I first started in 2006, my husband would note that every time I had my rotation here, I'd come back and it was the happiest that I was. And so I think it's the culture. There's an amazing culture here. What drew me to spinal cord and brain injury medicine are the rewards that you get from seeing patients progress from very ill, sometimes coming from the ICU with a million medical issues, to getting around on their own and becoming very independent. And one of the most amazing things is seeing patients come back years later, or getting cards from patients when they graduate, when they get married, because oftentimes that may not have been possible without the rehab that they got here. I have 4 different teams here at Shepherd, 2 spinal cord teams, 1 brain injury team, and a med-surg team. And I'm lucky to have probably the most amazing teams in the hospital. They're young, dynamic, and huge patient advocates. The first questions when a new patient comes in often has, if it's a spinal cord injured patient, will often have to do with, well, when am I going to walk again? You know, what can I expect here? And that's a tough question to answer. You want to be aware that, you know, their lives have been turned upside down. And so one of the things I do is I try never to use medical terms, try to put everything in layman's terms. That helps in explaining to them what's happened. And then I think there's a lot of reassurance involved, reassuring a family that they're kind of at their low right now. This is when they've got a lot of medical issues, their function is gone, but there is light at the end of the tunnel. I have 3 little girls, and so weekend life is very busy, and my life outside of here is very busy. So we spend a lot of time at the parks, going to the aquarium, to the zoo. So what I saw in single life as very boring is now the center of my life.